Hi, I'm Dr. Blad with New Leaf Chiropractic, and today I wanted to show you how to properly use the neck orthotic and the lumbar roll in your posture correction. So the first thing to correcting your posture is chiropractic adjustments to unlock the spinal vertebra. The second thing is to use these devices, these orthotics, to then correct the posture. And the third thing are strengthening exercises to strengthen so that you can then hold that posture. So these are really important, and they need to be done in the proper step, and it takes a proper amount of time to get these done. It's just not an overnight thing. Typically it takes 2 to 3 months before we start to see some real good posture correction. So let's start with this neck orthotic. This is something that if you're not ready to use this, I recommend using a towel first, and I've got another video on my website that explains how to use the towel. But once you use this without pain for a couple minutes, then you're ready to use this. But if you use this and there's immediate pain, then you're not ready. You need to use the towel first. But what you do is you place this behind the neck, and you're going to put it at what's the mid part of the neck. So you've got the occiput, which is here, and then down here's your thoracic. You want to go right in between. So if you bend your neck back a little bit, there's going to be a crease there in your neck. So we want to put it right there. So go ahead and lay down Lexi. And we're going to scoot down that way just a little bit. There you go. So as you can see, it's right. That's the proper placement right there in the middle. Now what's important is, Lexi, go ahead and bend your knees. It's super important when you do this to keep your knees bent while you're doing it. So that's for the neck. Now you want to start with 2 minutes, and then every day you work your way up to 3 or 4 minutes until you get to 15 minutes. So you want to add a minute a day until you get to 15. 15 minutes is your goal. Now to do the low back, you put this is a half roll, and we stick this right in the small of your back, okay? And you should feel, do you feel your hips coming off of that right there?
Yeah.
Okay. Is that painful, doing that? No? Okay. So it shouldn't be painful. However, after you do this for a couple minutes, again, you might start to feel some pain. Now, if your neck starts to hurt while you're doing both of these at the same time, and you might not need to do both of these. I might only prescribe you the neck, or I might only prescribe you the low back. It just depends on your posture analysis or what your posture analysis says. But if you're doing both of these at the same time, if one of these starts to hurt, then just take that away and use this. Use one or the other for another couple minutes. But again, the idea is the same. You always want to add a minute a day until you get to 15 minutes. At 15 minutes, you keep using it for 15 minutes every single day, and you're gonna do this every day for about 3 to 4 months, depending on what my prescription is. And again, that's based on how much curve in your neck that you have, or if you've actually lost your curve or have a reverse curve. But this is super important in part of correcting your head forward posture or your upper cross and lower cross syndrome. This is what puts the curve back into your neck or low back. And remember, you need those curves in your back and low neck. If you don't, then all the pressure goes to one vertebra, and then it degenerates, and that one vertebra takes all the load, and that vertebra starts to break down, and you get degeneration, and then you get nerve impingement, you get herniated discs, and eventually you could need surgery. So it's this is so important, especially with all the sitting that we do and the head forward posture that we have. This is crucial to do every day to bring back that forward posture that we get from looking at our devices, from using the computer, and get us back into an upward position. Okay, hopefully this is something that'll help you out. And if you have any questions, just reach out and I'll be happy to answer them. Thanks.